But I feel very blessed to be with you all, even if it is virtually today, to talk a bit about the role of the workforce system in addressing the opioid crisis and thinking more broadly just what we do within my program to help get people back to work who are part of the recovery and the justice systems. And as Travis said, my name is Morgan Kirk, and I am the director for our workforce recovery program at the Kentucky Chamber Foundation. And I'll be honest, prior to working here, I wasn't even aware that the Kentucky Chamber of Commerce had a foundation. So I just wanted to briefly share this slide with you all that kind of shows many of our programs and our training initiatives that are in place to advance economic and social well-being of folks here in Kentucky. So whether you're talking about our Center for Diversity, Equity, and Inclusion, that's about educating businesses on best practices, to what I affectionately call our cutest program, Bus to Business, which is about connecting students to career pathways. We really do have a wide array of ways to help connect different populations to employment. And of course, workforce has been a topic of concern for business leaders and policymakers for years now. The interest really, I think, shot up with the onset of the pandemic in 2020, followed by that struggle to find workers to kind of help rebuild the economy. In April of 2020, so right as that pandemic was coming on, we saw that 23 million Americans were unemployed. And so the national unemployment rate soared up to almost 15%. And here in Kentucky, we sat at about 16.8, so almost 17%. But really, the pandemic and that recovery we're going through just accelerated some of our pre-existing trends and magnified where we saw some weak points. And I think that's really especially the case here in Kentucky, where the data tells us that since 2000, more and more Kentuckians have not been participating in the workforce. In fact, fewer adults here in Kentucky participate in the workforce than in almost any other state in the nation. And while we've actually almost restored our workforce to sort of those pre-pandemic levels, that still puts us behind the nation and behind our surrounding states. So our challenges certainly didn't happen from any singular cause over the last 2 decades. So looking for solutions aren't singular, which is why I kind of wanted to share this for our foundation to show that we have so many initiatives to try to answer to and work on some of those workforce issues. But of course, I'll be focusing more on Kentucky Comeback and our workforce recovery program. But just starting with, why we do this work. Many of you may know that Kentucky currently ranks 43rd in the nation for workforce participation. So that puts us in the bottom 10 amongst states like Mississippi, West Virginia, Alabama. And then your top 10 are, you've got states like the Dakotas, Colorado, Nebraska, states like that. And so when we talk about it's not any singular cause, we know it's pretty complex. So when we think about demand for workers, it's really strong and has been for the past several years. In any given month here in Kentucky, there's generally 90 to 100,000 open jobs. But more and more, these jobs require skills and training beyond a high school degree. And I think estimates suggest that between about 65 and 85% of jobs today require training and credentialing kind of beyond that high school diploma or GED. So we know that the gap between skills that workers have and the skills that employers need is pretty wide here in Kentucky. You see those stats there. That's from the National Skills Coalition, assessing that only 48% of Kentuckians have skills training beyond that high school degree. But for the jobs that are available, 58% of those jobs require skills and training beyond that high school degree. We also know that a lack of childcare services can negatively impact individuals who are looking for work. And due to difficulty finding that childcare, the parents can experience more than $3,000 per year lost income for that lower workforce participation. So we know that the workforce participation of 11 million parents can be impacted by lack of access to childcare every year across the nation. And knowing on the flip side that increased access to affordable childcare is directly linked to higher female workforce participation and employment rates. The Pritchard Committee actually did an analysis here looking at Kentucky and the lack of access to childcare, showing that it's difficult everywhere, but especially in rural areas. I know I experienced that myself. As I said, I live in Eastern Kentucky. I'm in Perry County, and I've got my 7-year-old home with me today because we had an issue with childcare before school starts tomorrow. So it's something that I experienced firsthand, and I'm sure many folks on the call do too. But access to regulated childcare providers has been declining here since 2013. So you've got over 1 million Kentuckians who live in childcare deserts. We also see one of the root causes being around baby boomers, knowing that many retired in 2020, over 3 million, in fact. But really, what I want to focus on today and think through, and you heard Travis talking about some of these numbers earlier, accurately quantifying the full extent of the impact that substance use disorder crisis is having on the workforce here is really difficult. But some research has estimated that the opioid epidemic has been responsible for, I think, over 20% of the decline in workforce participation for prime working age men. And Kentucky has some of the highest opioid abuse rates in the nation, as measured by drug overdoses. So I know you saw this from Travis earlier, thinking about the rates in 2021, but looking at the Kentucky Office of Drug Control Policy's report, there was that 49% increase in drug overdose deaths in 2020. So that went from about 1,300 individuals lost to overdose in 2019 to over 1,900 in 2020. And then, of course, in 2021, those numbers coming out were at 2,250 individuals lost to drug overdose. And that's a 14.5% increase from 2020. And so we know the impact of substance abuse on Kentucky's workforce can be disproportionate compared to the rest of the nation. I know the University of Kentucky, some economists there found that the opioid epidemic could be responsible for up to 3.1 percentage point reduction in Kentucky's workforce participation rate. And that's representing, up to 55,000 workers. And we know with that loss of workers, Kentucky also is losing up to $169 million in state tax revenues each year. And we know that as the country's unemployment rate increases, even by 1 percentage point, that the opioid death rate can increase 3.6%. And you also see an increased visit rate to the emergency department for opioid overdoses increasing. And so it's clear that employment can really play a critical role in maintaining and sustaining recovery. So when we think about how opioid use impacts employment, we know that opioid use can be associated with increased injury in the workplace, right? Employees using opioids to treat their pain can present a safety liability. We know that people struggling with opioid addiction miss nearly 50% more work than the general workforce, and that substance misuse and related disorders are estimated to cost more than, I think, about $400 billion in workplace productivity in the United States. And then when we compare um, about 36% of people with substance use disorder, and then 42% of people with opioid use disorder related to that pain medication worked for more than one employer in the past year, right? When we think about retention, and that's compared to 25% of the general workforce. And kind of on the flip side of that, we know that individuals in recovery have 10% fewer missed days overall and an 8% less turnover than the general workforce. So again, we see what a critical role access to the workforce can be for both a person in recovery and for the businesses who are open to hiring from fair chance populations. And of course, that's thinking about someone who may be in recovery or someone who has justice involved background. And that's where our workforce recovery program can really partner with businesses and community organizations, many of whom I saw very familiar names as I was looking over the attendee list, to really help businesses to increase their workforce participation by preparing them to hire and retain from those fair chance populations. So I want to spend some time talking about the initiatives through our program that are focused on supporting businesses in finding, hiring, and retaining from fair chance talent populations. So thinking about how to expand their talent pool, increasing talent pipelines that include fair chance talent, and how we provide training and education around fair chance as well. So, the first thing that I want to talk about is the Kentucky Transformational Employment Program, which we affectionately call KTEP. And it's really a collaborative effort that was completed statewide. We had a lot of partners helping along the way: the Kentucky Cabinet for Health and Family Services, the Kentucky Office of Drug Control Policy, Kentucky in a Health Collaborative, and the Kentucky Opioid Response Effort. I always say it kind of takes a village to get things done. And I think that's so true because it's important to have more than one organization at a table when we're talking about the needs of the community and meeting people where they are because we have such different perspectives. And so this KTEP is the result of Senate Bill 191, which was signed into law in 2020, and it's now under the KRS number that you see there. And this program is really about providing a framework to foster that economic opportunity for people who've been impacted by substance use disorder and to help facilitate employer led access to substance use disorder treatment. We know that Kentucky's been really hit hard by the addiction crisis. And given the importance of employment in the recovery process, we know that business leaders are looking for kind of that clear pathway with steps that they can take to help reduce stigma around addiction and encourage recovery while in the workplace. So KTEP provides employers with the framework to really better support their current employees and even job candidates who are impacted by substance use, really ultimately looking to improve their ability to find and retain the workforce they need, not only to maintain but grow their business, while also providing Kentuckians with the opportunity to access treatment and achieve that long-term recovery from substance use. And I know many people are probably familiar with terms such as fair chance or second chance employment, which really kind of aims to ensure individuals in recovery or impacted by substance use have a fair chance at work, right? So with the Kentucky Transformational Employment Program, we want to go beyond thinking of just a chance at employment, but really seeing the opportunity to transform that employee's life and the employer's workforce by supporting and connecting employees impacted by substance use with very meaningful employment. And we know that recovering from substance use disorder includes a lot more than just traditional healthcare treatment, which is also very important, but there are lots of other services and resources that somebody needs to be able to reach and sustain long-term recovery. And we know one of those is that stable employment. So employers that choose to participate in this program, KTEP, have the opportunity to offer that transformational employment, right, for the employee or for the job candidate, something that can really lead to helping them live healthier and more productive lives while also strengthening our state's economy. So participating in the program provides employers liability protection for any civil action alleging negligent hiring or retention practices, excuse me. So essentially, any person with that conditional offer of employment or a current employee who may test positive on a drug screen can be offered services by their employer, being assessed by a qualified treatment provider. So it's certainly not an employer providing the treatment or deciding a treatment plan, but having the connection with a qualified treatment provider so that together they can determine sort of that personalized treatment plan to give the individual that very best chance at recovery. And so once the candidate completes treatment, or the current employee, or follows the recommendations from that qualified treatment provider and then tests negative in that follow-up drug screen, that hiring process can continue, or that regular employment will be able to resume. And of course, we at the Workforce Recovery Program will help a business kind of step by step through this program, from getting started, getting an established connection with a qualified treatment provider, helping with policies and procedures, anything that we're able to do to make this a very easy program for a business to take on, because the main goals really are about supporting people with substance use disorder and facilitating that access to help increase the number of employable individuals here in Kentucky and improve that talent retention. So if there is an issue around substances at work, it is not an automatic firing or halting that hiring process, that there is the ability to pick up sort of where you left off. Now, as I said, this law came into effect in 2020, and we spent some time in 2021 to figure out how to create programming around it so that this law really did what it could do. And so, September 2021, we launched the KTEP program, and we now have 78 businesses who are active with us. And between them, they have over 14,000 employees. And so, these are businesses who have signed up to think about and go through the process of making sure that the individuals who work within their facilities, at their organizations, know that they will be supported in their recovery progress, that it is not something to sweep under the rug, to be silent about through stigma, but that they want to support them. They are part of this organization. And so just breaking it down by the top three industries, you can see that we have 37% in manufacturing, with the next two top industries being in healthcare and business services with us. And so that's out of those 78 uh, organizations that I spoke to. Where we would love to see some growth is in construction and hospitality, because we know those are the industries where the most overdose deaths happen related to substance use, when you break that down by industry. So that's where we're trying to increase our footprint, and have more conversations with business leaders in hospitality and construction. And as we think about how to prepare these businesses to hire from fair chance populations, we didn't want to really make it be about if somebody shows up who's part of a fair chance fair chance population, that you will ensure they have that fair chance to work. But how do we intentionally make connections with business leaders and individuals who are part of fair chance populations? And so that's where we look into creating fair chance pipelines, introducing business leaders to recovery centers, working with some of our great state partners through career centers, through site programs, to be able to work hand in hand to go into jail systems and talk with individuals who are in recovery or have justice involvement, to talk about what skill set they have, what they're interested in, the experience they have, and where they want to re-enter the workforce, and introduce them to business leaders who can give them that opportunity, when they're qualified and able to re-enter the workforce, so that these businesses have a direct connection into an opportunity to hire from fair chance populations. And so you'll see here, we just have pictures from Hazel Hills and from the Marion County Jail, where our program manager, Ryan, has connected with local businesses, local organizations, to be a part of the Fair Chance Talent Pipeline work. And one of our newest pilot projects that we're doing is with the Department of Corrections Reentry Team, and of course, our talent pipeline team here within the Kentucky Chamber Foundation. And what we are doing is hearing from the reentry team the needs assessment that they were completing with individuals who were coming out of incarceration. So that 30 days prior to release, the reentry team completes needs assessments with them. Not a lot had been focused on for a particular skill set or experience around employment opportunities. And so that's where we came in to talk about what the critical jobs are, what those skill sets are. And we decided on for the pilot focusing within manufacturing and construction. And so for our team, both our Kentucky Talent Pipeline and my program within Workforce Recovery have made connections with businesses across the state who, of course, are open to hiring from fair chance populations within the industries of manufacturing and construction. And we've created a list to be able to share with the Department of Corrections. So as the needs assessments are being completed, they're asking about any experience or skill set in manufacturing construction so that when the reentry specialist is working with that individual, they can make a direct connection to, Amy at Construction Inc. to say, hey, we have Joe who's being released in the next month. Here's what his experience is going through sort of that resume of the individual to get them connection to employment prior to leaving that facility to help with the gap that normally exists when looking for employment opportunities. So, of course, as we make those connections, we want to make sure that businesses feel prepared and have what they need to be ready to hire from the fair chance population. So we have our employee resource guide and website, as well as our newest venture with our Fair Chance Academy. So the employer resource guide is on our website, and that's kentuckycomeback.com. And it's really intended to educate business leaders about substance use disorder and mental health. The tools in the reference guide can really help an employer create a recovery friendly culture and reduce the stigma in the workplace that we know can exist from even the language, as you heard Dr. Ellswick talking about earlier. So each section of the guide is kind of meant to help business leaders better understand how substance use disorder could be impacting their workforce and how to compare what their current policies and practices look like to today's opportunities when we talk about hiring, treatment, recovery, and prevention. So they really aim to help leaders learn how to maintain that drug-free workplace while supporting the recovery-friendly environment. Because we know that this change in culture can really net some positive results from that bottom line for an organization. So truly our mission with this kind of reference guide is to provide practical tools and information. We want to go beyond acknowledging the problem to offering solutions to help individuals take action as they're looking at increasing their workforce and kind of tapping into that untapped talent pool for individuals. So on here, we also have an inventory form to kind of identify barriers and challenges facing an organization, kind of filling in the gaps in their workforce. We've got information on challenges in recruiting and retaining talent, how to validate a candidate's background and experience while complying, of course, with legislative mandates that exist and kind of guarding against litigation that can happen. And we also provide one-on-one trainings or trainings to lots of businesses at once, really aimed at ending the silence that supports the stigma that occurs within the workplace, helping organizations to be a champion at learning and understanding and educating about the challenges created by substance use disorder and mental health. And so when we think about, recruiting and retaining employees that are in recovery, an organization has to create a recovery friendly culture. It has to be an inclusive environment. And so we offer examples for policies and procedures that need to be evaluated to correlate with that change in culture. And also just information about the importance of consulting with their legal departments to create these policies and procedures as well. And we also look at employer benefit plans, trying to help show as valuable a tool as it is to attract new talent. You want to make sure that you're looking at making sure that provides support for individuals in recovery or who may need assistance when they're thinking about beginning that recovery journey. And so the newest venture for us has been the Fair Chance Academy. As part of our ongoing efforts to address Kentucky's workforce challenges, thinking about hiring individuals who need that fair chance, we actually had a graduation for 20 business leaders from their Fair Chance Academy program in June. The business leaders that participated, they're certified as fair chance employers now, and that's through the Kentucky Office of Drug Control Policy and the Kentucky Chamber Foundation. And this certification is really about serving as a clear commitment to finding, hiring, and retaining fair chance talent. And this program took place over 3 full day training sessions. We did it kind of every other week, May 11th and the 25th, and then ending on June 8th. And we held this at the Kentucky Chamber of Commerce office in Frankfort.